Dr. Jordan Stern. I'm an otolaryngologist, head and neck surgeon, aka ear, nose, and throat doctor, ear, nose, and throat surgeon. I've been practicing for 17 years in New York in private practice and in hospital-based practices. And recently I've been involved in the diagnosis and treatment of sleep apnea, and in particular the development of new devices for home testing for sleep apnea. Sleep apnea is something that people should be worried about because the likelihood that a significant percent of the population is involved is very real. If you look at the academic literature, studies that have been published that look at the incidence of sleep apnea, the numbers seem relatively small, maybe 4% of the population. But more and more, we're realizing that it must be much more common, and the reason is that it's associated with obesity. And we know that there is an epidemic of obesity in the United States and in many other countries. The other problem with the statistics that exist today is that they are based on studies that have diagnosed sleep apnea for patients who have been in a sleep lab. And until recently, there were not many sleep labs available to patients. And also many patients did not want to bother spending a night in a sleep lab, which was until recently the only way to diagnose sleep apnea, and in particular obstructive sleep apnea. And I think that new technology available now and as of the past couple of years will significantly change this. And I am convinced that we will find that perhaps 30% of the population has sleep apnea. Sleep disorders have historically been treated and diagnosed by medical doctors specialized in respiratory medicine or pulmonary specialists. Obstructive sleep apnea, which is likely the most common sleep disorder, is really a disorder of the upper airways. The upper airways are the conduits or the tubes that bring air from the outside world down to the lungs. So it's the nose, it's the back of the nose, the mouth, the back of the mouth, the deep part of the throat, the larynx, which is the voice box. And those are areas of the body that are treated by ear, nose, and throat surgeons. My background in particular has been the treatment of tumors of the upper airway, and as a result, lots of patients that I have seen with tumors who have upper airway problems have led me to the interest of diagnosing upper airway obstruction in patients without tumors. And the largest majority of patients who have this disorder are patients with sleep apnea. It's very important when examining patients who may have sleep apnea to examine the airway not only from the outside world, but to examine the airway from within. And we do that using nasal endoscopy or nasolaryngoscopy, which is using a thin fiber through the nose and evaluating the structures that comprise the airway. The back of the nose, the deeper part of the throat, the tonsils, looking at the diameter, and from there predicting which patients will do well with what kind of treatment. So what is sleep apnea? Sleep apnea is a sleep disorder where the upper airway during sleep at night collapses intermittently and prevents the sufferers from being able to breathe continually. And when the collapse lasts more than 10 or 15 seconds, the sufferers will usually wake up repeatedly every time they have one of these events, and in effect have a very poor night's sleep. Now, not only will they have a poor night's sleep, but their body will suffer from repeated stress reactions every time there is an obstruction of the airway. In effect, these patients are having suffocation events up to 20, 30, 40, 50, sometimes 100 times an hour. And as a result, there are many physiological changes in the body that eventually lead to serious disease.